Shortly after 3 p.m. on Tuesday, October 2nd, in the year 1883, tragedy struck the young community of Rockford, Illinois. 6-year-old Freddie Griffin and his buddy were playing around the freight train cars that ran past Freddie's house on South Water Street. According to newspaper accounts,
Fred had caught hold of the iron slides upon which the car doors slide, and hanging on these would ride along a short distance, swinging his body beneath the very wheels of the cars. Suspended from this dangerous perch by some means or other, the boy lost his hold and fell beneath the ponderous car wheels.
Badly mangled, the boy was brought into his home, described by the paper as
a pitiful picture of poverty.
And doctors were immediately sent for. Despite the best efforts of the town doctors to perform life-saving surgeries in the poverty of the Griffin home, Freddie succumbed to his injuries. Rockford citizens, including physicians and clergy members, were deeply moved by Freddie's tragic death and quickly mobilized around the need for the community to establish a hospital. Among the first acts of the newly formed Hospital Association was to raise money. In just 2 years' time, the outpouring of charity resulted in the establishment of the city's first hospital. That cottage hospital on the corner of Court and Chestnut Streets in downtown Rockford is the forerunner to the Rockford health system of today, the region's largest and most advanced medical center. Community philanthropy has been a vital part of our growth and development at every stage of our history. Fast forward to the new millennium, and the tradition of charitable giving is now spearheaded by the Rockford Memorial Development Foundation, the philanthropic arm of Rockford Health System. Whether for facility initiatives, the purchase of leading-edge equipment, providing for community health needs, or enhancing the patient experience through care and comfort items, the foundation encourages and manages charitable giving, connecting the benevolent intentions of donors to important projects and causes at Rockford Health System. Helen Howell was a 35-year clerical employee at Rockford Memorial Hospital who left her entire estate to the foundation to benefit her hospital family. Helen Howell's extraordinary gift funded a much-needed renovation of the hospital lobby, which was completed in 2004. The new lobby includes a beautiful glass donor wall that recognizes our most generous donors. And the legacy area traces milestones in the history of Rockford Health System over more than 125 years.
I never knew Helen Howell, but I hope she would be proud of all that her gift has made possible. Those of us who remember the old hospital lobby can truly appreciate the difference. Now the renovated Helen Howell Memorial Lobby is warm and friendly and welcoming. It's soothing for patients, their families, visitors, and staff alike. It truly sets the tone for an excellent patient experience.
Enhancing clinical excellence and the patient experience have been the focus of many foundation-supported renovation projects at Rockford Memorial. In 2006, the foundation raised funds for the nursing unit on the 3rd floor of D Wing. The project transformed the D3 unit, creating all private rooms and adding remote monitoring capabilities. The following year, our fundraising efforts moved down 1 floor to D2, where orthopedic, spine, neuro, and other surgical patients receive care. Community philanthropist Cedric W. Blazer, who himself had been a patient on the unit, took an interest in the project and pledged a major gift toward its completion. Sadly, Mr. Blazer passed away before the opening in 2008 of the renovated unit that bears his name.
We are grateful for Mr. Blazer's generosity and his foresight. We believe that providing excellent care to some of our most fragile patients is the best way to honor his legacy.
Each year, the Foundation's Board of Directors selects a project to support through fundraising and through special events, like the annual gala and the golf outing. For example, thanks to the support of our sponsors and donors, the renovated emergency department opened in 2010. Recently, a project to update the mother-baby unit was completed. And the adult critical care unit on the 1st floor of the hospital celebrated its reopening after extensive renovations. All were supported by Foundation funds. Donor support has also enabled the purchase of equipment for clinical programs, like specialized giraffe beds and isolettes for the neonatal intensive care unit, a self-enclosed pulmonary function lab for the respiratory care department, specialized instruments for neurosurgery, home monitoring equipment for clients of the Visiting Nurses Association, and dual-plane angiography for the cath lab, to name a few.
Physicians really value what donors to the Foundation make possible. A few years ago, we identified a major piece of equipment that would benefit our heart patients, but it was after the regular capital budget process was closed. The foundation stepped in and used the donor's gift to immediately fund the purchase.
Our donors also recognize that lifelong learning is central to our mission and have funded ongoing education and training for caregivers. In fact, more than a dozen donors have created named endowments at the foundation, including the bequest that funded the Richard H. and Ruth C. Tower Endowment for Education. Proceeds from the Tower and other endowments provide scholarships and training support to Rockford Health System employees. Donors to the foundation also help Rockford Health System provide care to those in need. Donor Ann Armstrong established a fund that provides free mammograms to women who otherwise might not be able to afford this life-saving screening. That program has now grown to include a partnership with a Silver Lining Foundation and is the only free mammogram program in our community. Another vital community program is the CareMobile. Completely funded by philanthropy, this partnership between the Rockford Health System Children's Medical Center and Ronald McDonald House Charities of Madison delivers free medical and dental care to needy children in 5 northern Illinois counties. Through the Family Giving campaign, employees at Rockford Health System provide support to their colleagues. One part of the annual employee campaign provides emergency assistance to employees who face a crisis. Like Marie, a nurse's assistant at Rockford Memorial, whose house caught on fire when her 2 daughters, a teenager and an infant, were home alone. Sustaining burns herself, the older girl shielded her baby sister and brought her to safety. The home was a total loss, and the RHS Crisis Fund stepped in to help the family recover from the devastation.
You know how some people say, if you need me, I'm there for you? And I was like, I can actually say that, they didn't just set up something and it's like, okay, we're here if you need us. They're actually here if we need them, and you can't put words in that.
Our employees also join with the RHS ambassadors and many community donors to help provide little care and comfort items that can make a big difference for the patient experience. Here are just a few examples of what our departments have purchased with foundation funds. Crib mobiles, toys and games, fish tanks, magazines for waiting rooms, comfort baskets for family members of oncology patients, flowers for the campus, blanket warmers, patient education materials, fans for homebound patients, last day of treatment celebrations for cancer patients, videos for patient entertainment, artwork, breakfast snacks for families of hospitalized children, coffee pots for hospital units, and much, much more.
On behalf of the patients and the families who benefit from your generosity, I want to thank all our donors, sponsors, and volunteers for their support of the Rockford Health System Superior Care mission. With grateful hearts, we ask for your continued support, and in turn, we pledge to be faithful to the tradition of philanthropy that makes good and important things happen at Rockford Health System.